Hey, how's it going? My name is Christian Frazier, and I'm here with Dr. Wesley Willis. And we wanted to talk to you a little bit today about mental health. Since it is Mental Health Awareness Month, there are a few strategies that you can use to deal with some issues like loneliness, childhood trauma, relationship trauma. So I'm going to turn it over to Dr. Willis and actually tell us a little bit about himself.
Okay, yeah, thank you for interviewing me. So yes, my name is Dr. Wesley Willis. I am a licensed psychologist, a licensed clinical social worker, and also a registered nurse. Have worked in private practice for over 15 years, treating individuals from anything from post-traumatic stress disorder to now more significant mood disorders and also sexual trauma victims and stuff like that.
So tell us a little bit about what someone can do that may be dealing with, say, sexual trauma, relationship trauma, past traumas, and what they can do before they actually get to see you as a therapist or in between sessions.
Mhm. Well, there are a number of things actually. Sometimes it's important to know when the trauma happened. Was that trauma in childhood or was that trauma in adulthood? We have what we call ACEs, or adverse childhood experiences, which kind of help shape the experience of that now adult mind.
Mhm.
So when a person has an ACE or trauma that happens in childhood, they show significant emotional reactivity in their amygdala or their hippocampus. So they're hyper-reactive versus that person who has that trauma as an adult. They already have moved into their frontal cortex. So they're able to process things a little better. Things that I do with my patients who have had ACEs is work on first healing that childhood experience. Sometimes things like writing a letter to the perpetrator that was that person. It doesn't have to be mailed. It doesn't have to be, again, given in person. It can be just for yourself to get that out. Another thing I like to do with adults who experience trauma in childhood is do what we call narrative training work, changing the narrative. Now learning to move from that victim to that survivor or that thriver. If it's an adult who had the trauma in adulthood, again, is to work on things like triggers. Because again, as a trigger sets off a whole different level of emotion and reactivity. So again, as an adult, you also have now more ability. You can press charges. You no longer are always stuck in that helpless mode as an adult because you're able to process that. Most child victims who are now adults kind of like have this sense of emptiness because they were a child. Nobody's now here to kind of right that wrong for them. So they have to right that wrong for themselves as an adult. So that's the things that I work on. Like some of my patients who have trauma are also substance users. So one of the things that I like to use is this thing, what we call seeking safety. We used to think that individuals who had trauma and also substance abuse, that you had to attack one or the other first. But what we've seen is a lot of the literature supports helping the person become safe, whether that be, literally safe from a domestically violent relationship or emotionally safe. To be able to now start decreasing the usage in numbing or psychoactive type of substances.
So, that's very important. And you talked about triggers. One of the things that I've noticed is that a lot of us may not understand how to identify what our triggers are.
Mhm.
And I think that it's important to understand what your triggers are so that you can deal with them, as you said.
Very much.
And especially, I found in relationships, like in the beginning of relationships, it's important to talk about those triggers and things that happen, to you in the past with your partner. So that way, when it's something like that does happen again, you can let them know that, hey, we're not in the same place. It's not the same situation. So that was really important. And then you mentioned about the substance abuse. It comes along with trauma.
Mm-hmm.
People are trying to figure out ways to heal themselves or self-heal themselves.
Mm-hmm.
And slowly weaning people off of it. I mean, it sounds like an amazing method to give somebody the freedom of healing.
Mm-hmm. Yeah, thank you. I mean, there's a large body of work to, things like smart recovery, smart recovery or moderation management. As that person again build the tools and skills to be able to now deal with life, really in this kind of very clear way, without the substances. So yeah, I mean, I do a lot of things like I work with a lot of other therapists and helping patients understand body work, like tuning into their body. Because like you said, people don't always know their triggers. So, but they do know their body. They do know when their body's at rest versus a body that's kind of like in what we call fight or flight, that's ready to run, that mind starts racing, heart starts going. And so after a while, after they start doing it, it becomes second nature. But to do the body work, just recognizing when I do become tense, when I do become anxious, when my heart does start racing, when I have patients who openly say, "Doc, I go red," like they literally go red.
Eyes go red.
Exactly.
Do you recommend to your patients to journal those activities?
Oh, most definitely.
Yeah, I think it's really important for us to monitor our mental health and document when we're in stress or under stress, special environments, so that we can, determine like how we reacted to that situation. I know like when I talk to my therapist, I explain to them like over time, I expect my reactions to certain things to decrease.
Mm-hmm.
And so we talk about that, in therapy, like this happened again, but I didn't freak out this time.
Mm-hmm. Right.
So it's like it's a journey, and we're slowly taking it there. It doesn't happen overnight.
Right.
So that's one of the things that I noticed. I have a question for you about. I guess you mentioned like getting out of that fight or flight type of mode, which is like our brains are constantly going there. Do you recommend like what type of therapy did you recommend somebody to do when they're in that mode? That how you get them out of that fight or flight mode?
Mm-hmm. Mindfulness work, which we're finding is really useful. Again, the ability to like take deep breaths to pull yourself out of those moments when you feel your kind of what we call like your autonomic nervous system going into overdrive. So mindfulness, again, tuning into your body, breath work, which I love breath work. I don't do it enough, but I have taken a lot of classes because it is just incredibly calming.
I'm a certified to teach mindfulness meditation.
Exactly.
So I started like 3 years ago.
Oh, awesome.
And I think that literally has changed my life. Mm-hmm. And I do it every time when I'm feeling stressed out.
Right.
Or something's happening. I just take the time, because what I've learned is that our minds are constantly worried about what people did to us in the past. Mm-hmm. And what's going on right now, and we're worried about what's going to happen in the future. So the mindfulness kind of pulls us into the very present moment where there's nothing going on except for, just life and breathing right now. And it takes us off of that worrying and being in that fight or flight type of mode.
Right. Exactly. I mean, that is so true. I mean, being caught up in the past or caught up into, again, what if this happens in the future? How useful is that in your present? So being present is an amazing skill. So learning to be present. Another thing I encourage patients to do is what we call behavioral activation. If you're laying on the sofa and you feel yourself going into those moments like, damn, I should have made better choices in life. And, I wasn't given all these chances, all of what we call regret orientation. Get up, get active, go to the kitchen and like start cooking something. Cooking is my therapy. Cooking is my therapy after the therapy, after I do the therapy.
I tell people you should do what you were created to do. Like if you're an artist, go create some art. If you're a musician, play some music, make other people happy. If whatever it is that you do, your hobby or something like that, cooking, do that. It actually really takes you out of that mode and it makes you happier.